Oh, there it is. Good. So the first slide of the presentation. So what is long COVID? Well, basically, as we all know, sort of long COVID came out of the blue, really, following on from COVID, as COVID came out of the blue at the beginning of last year, tail end of 2019, beginning of 2020. And initially, the pandemic kicked off in sort of March in England and in the UK, and then there was the first lockdown, 23rd of March, and we all know what that meant, and that was you've got to stay at home, as Boris Johnson said, and then in the sort of 2 or 3 months later, we were noticing that patients with COVID, acute illness COVID, some of them were just not getting better. And this was the group who were then dubbed long-term COVID, and that was abbreviated to long COVID here in the UK, long haulers in the UK, in the US. And then towards the end of the year, NICE, National Institute of Clinical Excellence, came out with their guidelines and definitions of long COVID, which basically is patients with COVID symptoms, having had the COVID illness, who was still symptomatic from 4 weeks onwards. So they distinguished between those patients between 4 and 12 weeks who had ongoing symptomatic COVID, and then from 12 weeks onwards as having post-COVID syndrome. Both of those sort of are encompassed by the term long COVID, which is, as far as NICE is concerned, it's not sort of technical and medical enough, but they recognize the fact that this term long COVID, which is a patient-generated or catch-all term, is what everyone refers to it as. And basically, long COVID is that, persisting symptoms when other diagnoses for those symptoms have been excluded. You can make the diagnosis of long COVID even in the absence of antigen and antibody testing, because as we all remember from lockdown 1, that very few people could actually get tested, because really it was only for people who were being admitted to hospital. Tests weren't freely available, and so they were very clear, NICE were very clear that actually you don't have to have a test to make the diagnosis. How common is it? Well, basically, it depends which study and who you're talking to, but basically between 10 and 15% of patients who have COVID, the initial illness, go on to become a long COVID, so 10 to 15%. But again, it's a case of watch this space. It'll be interesting in 6 months' time, a year's time, to see what the percentages are at that time. I very much fear that it's going to be worse. Who gets it? Well, there seems to be a higher prevalence in females, particularly in the working population age group, and particularly those who have mild illness or even asymptomatic, and often in patients who have been extremely fit and running sort of half marathons and what have you, and they tend to be particularly at risk. But of course, anyone can get it. So patients with long-term conditions, sort of cardiovascular disease or diabetes, for example, but also sort of those patients who have been unfortunate enough to be on sort of ITUs and having had the illness really seriously, they are at higher risk of getting long COVID.